Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical, and I'm giving you my weekly medical update. It is June the 5th of 2023, and thank you so much for listening to me. And I feel so blessed to be here this morning in good health and in good state of mind to help everybody I can this week. I hope you're having a good week, and if you're not, if you feel bad or you don't know why, that's might be a reason for you to come see us. I mean, we all have good days, we all have bad days, but if you're having more bad days than good days, I want to help you figure out what's going on, see what we can do about it. So let's talk about, so this is one of my favorite times of the year. It's springtime. However, in Raven County in particular, springtime comes with a few things that you have to deal with that I want to just talk about briefly. First of all, we always get these severe storms with more lightning this time of year, and it almost like clockwork at about 3:30 in the afternoon. You can bet on some rain in this community, but the thing is, you got to stay safe. Usually we're out on the water. I like to get out on the water. I also like to get in the swimming pool. So the rule of thumb, I believe, is if you hear thunder, you're at risk for lightning. Okay, and lightning deaths do happen every year across the country. However, I'm not aware of one happening recently, but just be mindful of that particular idea that these storms roll in. They're pretty fast and furious. A lot of times they're of high intensity and involve a lot of lightning. The next thing is snakes, and we've already seen way too many snakes this year, and I personally can't stand snakes. But the ones that I'm most concerned about, the one that seems to be so prevalent and to be everywhere, is copperheads. It scares me to death with my children, particularly my baby and my little baby dog, dealing with copperheads because they're everywhere. Just be mindful of them. Snakes is a big part of Raven County. Okay, if you live in Raven County, there is lots and lots of snakes here. Copperheads are the ones that scare me the most because of the prevalence of them. I know we got rattlesnakes here, but the copperheads seem to be. I've seen a multitude more copperheads in this community than I have seen rattlesnakes, but I have seen plenty of both. The main thing is, if avoidance is always the best way to deal with a snake. If you do accidentally get bit or something like that, seeking medical help immediately is always the thing to do, in a reasonable fashion as possible. Just don't get too excited, because I think excitement and adrenaline makes things worse. Of course, I'd probably be guilty of being more excited than I should have if I got bit. But try to keep calm and seek medical help. The other issue that I came in contact with yesterday afternoon is yellow jackets. Okay, and there's lots of people who are out there who are extremely allergic to yellow jackets. If that's you, make sure you got that EpiPen. Check your EpiPen. If it's out of date, you need to come see us. We need to order you a new one. You usually do have to have an appointment with that so we can update everything and justify it, just in case the insurance companies want us to do that. Okay, but yellow jackets, and usually they're a surprise, and they can be in the ground, they can be in a tree, they can be a part of your house. And if you are allergic, just seek medical attention quickly. Remember, if you are allergic and you use your EpiPen, I want you to go to the hospital. Go to the emergency room. Even if you use your EpiPen and it works, you still need to go to the emergency room, because the EpiPen has a relatively short half-life. In other words, it don't stay there long, and you can get a rebound of the anaphylaxis afterwards. That's something that we always got to pay attention to. And also, we give EpiPens in 2-packs, mainly because there's been a history of using one EpiPen and not getting a refill. So there's another one there. But anyway, keep your EpiPen. Avoidance, again, is always the best. These are just hard to avoid sometimes. Like last night, I didn't use my brain, and it hit me before I understood what was going on. And last but not least, when we're cleaning out those cleaning up around the house, cleaning the brush, weed eating, all that stuff, you got to deal with poison ivy. And it's poison ivy season here. The interesting thing about poison ivy is it usually pops up 2 or 3 days after you get exposed with irritated skin. If it's on your body, usually you need systemic treatment. If it's big enough, I mean, if you have a little area of it, you can treat it with topical steroids. But if you got a large area of it, then you need to have systemic therapy, and that's a good reason to come see us too. Okay. Again, avoidance is always the best for that. If you know you got exposed, cleaning yourself with soap and water, washing your clothes with hot water and soap is always a good idea. So those are my pearls for the day. I do want to remind everybody that we're still taking new patients, and we're taking Medicare patients in particular. So if you've got family or friends that needs medical care, we're open to it. We're taking new patients. We're inviting new patients. We like new patients. When a current patient gives us a recommendation, we really, really appreciate it. And we think that's the best way to go, is by people that we've treated good telling other people about it. So I appreciate it and thank you in advance for that. So this is Dr. Timothy Scott Beck. Our number is 706-782-0016. If you need to call us, you can also go to our website at drtsbeck.com and request an appointment or a new patient appointment. Just be mindful that I have humans answering the phone, so sometimes it's hard to get through, but I do have 5 full-time employees that are answering 3 phone lines during the day. So be patient with us and we will get to you. But thank you so much for listening. Have a wonderful week. Call us if you need us.